My name is Dr. Victor Narcisse, and today we're going to talk about the symptoms of diabetes. Many individuals who have diabetes will have no symptoms at all, whether you have type 1, type 2, or prediabetes. But that doesn't mean that you're not having damage. Mild symptoms may go unnoticed for an extended period of time, and during this period of time, the diabetes and the blood sugar being so high will cause difficulty. So it's important to know the symptoms when they do develop. One of the symptoms that brings a lot of people to attention is the fact that they're really thirsty or really hungry. These extremes in thirst or appetite are sometimes a sign that your blood sugar is very, very high, and that this can also cause you to become very, very fatigued. You may find that you're urinating very, very frequently, especially at night, and you may even have an unusual amount of weight loss. And while weight loss is typically a good idea for persons who have diabetes, this unusually large amount of weight loss at the time of diagnosis is a sign that your blood sugar has been a problem. Blurred vision or fruity odor on your breath, sores that don't heal, are other things that people will sometimes see. If you're seeing any of these symptoms, you really need to work with your healthcare provider to get the appropriate testing and checkup to find out your diagnosis and develop an appropriate plan. Well, who should be tested? Whether it's for diabetes or for prediabetes, the United States Department of Health and Human Services recommends that you should get tested if you are 1, over the age of 45, or 2, overweight, or particularly if you're younger than 45. But if you're younger than 45 and have high blood pressure or high cholesterol or a family history of diabetes, you should get checked. Additional persons who need to get checked are those who have an ethnic background that's African American, Asian American, Latino, or Hispanic American, Native American, or Pacific Islander. Additionally, if you've had gestational diabetes, or diabetes that occurs during pregnancy, or delivered a baby that weighed more than 9 pounds, your blood sugar might be elevated and you need to get checked. If you're checked by your provider and you have these risks, you should still be checked every 3 years. But if you have prediabetes, you should be checked approximately 1 to 2 years after that diagnosis. And if you've got diabetes, your healthcare provider will develop a strategy that works best for you. There's several different kinds of tests that will help healthcare professionals make the diagnosis of prediabetes and diabetes. You should be aware of them. The one that we use most commonly is called the hemoglobin A1C, or A1C. This is when a hemoglobin molecule is attached to a glucose molecule, and it's reported as a percentage of all your hemoglobin levels. This averages your blood sugar, your blood glucose control over the last approximately 2 to 3 months. This is quite helpful because it gives a very broad picture of what's going on and doesn't require any fasting. In this particular case, you need a hemoglobin level of 5.7 or 6 to 6.4 to make the diagnosis of prediabetes. And if it's 6.5 or higher, you've probably met the diagnosis of diabetes mellitus. There are other things that you can do. There's a fasting plasma glucose test. And so if you've been fasting, let's call it 8 hours or so, which means nothing to eat or drink, before the test, you can have your blood drawn, and then it will give a very, very clear picture. If your plasma or the water part of your blood has an elevated amount of glucose, it might mean that you have diabetes. In this particular case, the blood glucose reading that's of worry is between 100 and 125. In this setting, you might have prediabetes. When it's over 126, you might have met the diagnosis of diabetes. So again, 100 to 125 is prediabetes or impaired glucose or insulin resistance potentially. Blood glucose higher than 125 are rarely normal when it's fasting and may indicate that you have diabetes, particularly if you've taken the test several times and gotten a similar result. People with diabetes, again, have increased risk of type 2 of heart disease, stroke. So this is important to know. There are other tests that you can do that require a series of fasting blood sugar tests and the administration of blood sugar or glucose, and then to see how your body reacts. This can tell you a great deal, but it's something that isn't done quite as often because it's less convenient. Again, there are multiple tests that you can use working with your healthcare provider to make the diagnosis of prediabetes or diabetes. If you have diabetes or prediabetes, your healthcare provider might ask you to do home glucose monitoring with a glucometer. And that way you would check your blood sugar, often through a finger prick, and using this machine once a day or several times a day. Again, work with your healthcare provider to develop the best strategy for you, and also to learn what to do if your blood sugar levels are too high or too low. My name is Dr. Victor Narcisse. Wish you great health. Good luck.